Subscribe now for your regular dose of Asian health information.
It is absolutely safe to use some of these home acid treatments if it has been properly prescribed by your doctor. I think it's important not to just buy things off the internet because your skin may not be suitable for that strength of the acid that you purchase. Typically, most of the home kits are usually of lower concentrations. They're usually dumbed down so that users can use it at home. But nonetheless, the skin type may not be suitable. For example, if you have a dry, sensitive skin type, you just buy a BHA or AHA that's maybe 10% or like 12% off the shelves and start using it on a daily basis without any proper advice or assessment beforehand. You might dry out your skin and may cause other issues to surface as well and develop sensitivities from that. So I think it's safe to use if you use it under care as directed, and then once the skin is comfortable, you sort of get into a regime. I think it's okay to continue from there. One product that every woman should have, I would be absolutely hard-pressed to select one. I would say that I would typically, bring maybe 2 or 3 products if I travel with me. But I think the one thing that I would recommend almost everybody to use would be an antioxidant serum. I think that's really, really key to prevent photoaging and to reduce oxidative stress on the skin. It helps to combat things like photo damage, which gives you pigmentation. It helps to combat things like fine lines. It helps to plump up the skin and keeps it more hydrated and supple as well. So it turns back the clock, really. On the other hand, I really think sunscreen is important, but honestly, between the two, I think the antioxidant serum is the must-have for me, because if you're not going outdoors at all, then perhaps you don't need sunscreen. You should cleanse your skin typically twice a day, especially in Singapore's climate. I think most people that are of normal to oily skin types would benefit from a twice-a-day regime. Nothing more than that. I think that washing your face 3 to 4 times a day unnecessarily strips the skin of necessary moisture. And sometimes for people even with oily skin types, it may actually compound the problem. It makes the skin try to produce more oil to compensate from that. On the other hand, people with very dry and sensitive skin, typically you have the outbreak of eczema, I may recommend that they either dumb down on that, so they use it just once a day and wash with water for the other time, either day or night, or they can use a very, very gentle milk type cleanser. Before considering pigment lasers to treat pigmentation and spots, you can absolutely start applying some topicals at home to prime and prep your skin in preparation for that. Sometimes if you prime and prep your skin with some of these lightening agents, you might find that it's light enough for you, it can be covered with BB cream or something else, and some patients are happy with that, they don't even need pigment laser downstream. So absolutely, I think that some of the topical lightening agents, things with kojic acid, azelaic acid, a Klickmann's formula, something that contains basically tranexamic acid as well, can all be very useful to prep the skin ahead of time. Sometimes I also use a topical retinol at night that prepares the skin ahead of a laser. And also I typically would institute this after the laser as well as part of the overall combination. Typically, immediately after a laser, I would stop this topical lightening agents for about a week or so. I use a set of recovery creams, and then I get patients to start this about 8 days, 9 days out. And then this is usually partnered in between the various pigment laser treatment sessions, and this gives optimal outcomes. There's absolutely a chance that your spot can return after laser removal, especially if you don't use sunscreen. So I always tell patients that, contrary to what they think, after a laser session, the skin is actually even more sensitive than it was before, especially for the immediate 1 or 2 weeks. So I tell them that if they were not very good with sun protection and hence they got all this pigmentation that they had, it is absolutely essential that they invest in a good sunscreen and stay indoors as much as possible, especially in the 1 to 2 weeks after a laser treatment. If you're going to invest all that money doing a pigment laser, the aftercare is absolutely important. Why? Because the skin, when it heals, is very prone to browning as well, especially in Asian skin types. So you absolutely have to sunscreen, stay out of the sun for it to peel off nicely and for it not to develop what we call post-laser hyperpigmentation. I think that absolutely number one skincare mistake that people make will be probably using too many different products or switching between products too often. So that's what I call polypharmacy. So typically you see issues with people developing adult acne or developing sensitivities of the skin, typically facial eczema that cuts off nicely at the jawline, and you sort of like suspect that it may be due to the different products that they've been applying. It's a very common problem that we see, especially among women. We tend to shop and buy different products, especially when they travel as well, and mix and match them around. So sometimes patients come to you with these issues and they bring a bag of 20 different items, and then where do you start? So it's even very, very difficult for a dermatologist to tease through all of that products one by one, because sometimes they may have been trying 5 different products in the last 1 week or last 2 weeks, and you really have to get them to stop everything and then really either test them or patch test them to look for particular ingredient sensitivities, or really institute one product at a time. So the constant switching between products is not great for the skin. It complicates matters, it predisposes to allergies, and it also can make the skin worse. It can make the skin, piling on too many products can make the skin very tacky and very saturated as well. So definitely I believe in a more minimalist routine. So as long as the key essential building blocks are there, I think that's fine. And try not to switch between brands and switch between different products too often as well.
Subscribe now for your regular dose of Asian health information.